this is a pharmacy, so obviously I see a lot of unhealthy people. But healthy neighborhood would be places that people can buy fruits and vegetables, and the diet is adjusted for a lower amount of sugars and carbohydrates, and they do exercises and things like that. If you use that as a criteria, that's not the case here.
Definitely awareness is a big piece. If you go into Randall's Island or even off of the FDR Drive, you're still seeing folks who maybe live, below 96th Street and, are running, or, the culture of active living is already part of their everyday existence. But it's not your typical East Harlem, Central Harlem resident.
Since I've been working here, a lot of people that come in here have health issues such as high blood pressure, diabetes, other issues that they concern about, and also people that need to do like an internal cleanses. So organic foods and products, they work wonders for me. I feel more energized. I'm happy that I'm not on medication. I don't have any health issues. So this is what we're trying to explain to the people in the neighborhood. It don't always have to be you going to doctors and getting medication. It's good to go to the doctor to get checked out, but the medication that they're giving you doesn't mean you have to take it. So there's other alternatives that can help you with your situation. This is something different to them because you don't have this uptown. You really have it downtown. I mean, you do have a few, like maybe two, that's really uptown, but a lot of elderly people don't travel that far or can't travel that far. So this is something new to them. They coming in and they getting to know us.
When we first started looking at urban agriculture, like everyone downtown was like, why are you guys wasting your time? Like, it's not in terms of scale, in terms of like demand, in terms of how much. And then we started hearing people are growing hundreds of pounds and thousands of pounds of food, and they're, kind of creating their informal CSAs where they're bagging and giving it to the children to take home, or the seniors are sharing with each other. And so it's no longer just kind of like a frivolous, my hobby, but it can potentially have an economic impact in this community, right? Because if all these folks that are able to grow at this scale, well, what if we start looking at connecting them to the local businesses, right? What if we can really keep that local, buy local, very, very local connection, and then really support each other? There's always people at this center working on different aspects of public health. So we definitely have contact. But I think what resonates most is really the work that we do with our asthma families. We can get mold remediation services to go into your home. We can get pest management to go into your home. So when they're seeing that their kids are sleeping through the night, that they're not going to the emergency room 3 or 4 times a year, that says it all.
You do have people that are beginning, we have a couple of gyms and things like that. But as far as trying to get people healthy, I think they're trying, especially with the seniors. I work with a group of seniors. I actually have a health food store around the corner. And what we do is we educate people as to how to use their meal as their medicine. Hippocratic thing that says use your food as your medicine and your medicine as your food. And so we're trying to instill that. But the senior centers are also doing a great job getting the seniors to get out and walk and do things, exercise, that kind of stuff. But I think that's kind of on the late side. We need to do it for the younger kids and for the young adults. This neighborhood is changing. It's getting mixed. It's mixing. So I think over time, as the neighborhood changes, we'll see more healthier lifestyles.
I think our education efforts are starting to pay off. I think there still needs to be more work. And while we as a Department of Health and as a public health entity are moving towards the environmental systems change, the community doesn't understand that. They're not moving as fast as we are. So I think we need to also think about that and be realistic with the programming that we're putting in place. And by being realistic means that everyone needs to be around the table. Even those folks that may not be our advocates, but that have an impact, they need to be around the table as well.
I see that now it's progressing. Now they coming in a little bit more. So, but before was nothing, no business at all. So now they coming in and they trying things, and all their friends are trying it, and they telling them about it. So they coming in. So I'm actually excited and happy that it's taking an impact, on them. So.